Hi, I am Ann Pressman. I wanted to introduce myself since I was not with you the last time that you gave your speeches. So, have you ever felt like you're crazy? Like literally, completely bonkers crazy. Things just weren't right. You might be losing it. Like really tired too. Exhausted. Can't make it through the day. Like you're not doing it. It's just too much. And then you have maybe outbursts of rage, anger, irritability, screaming, yelling. I mean crazy. Like for no reason, you just go absolutely crazy. Or how about any of you were skiers or like going out in the cold or do things in the cold, but all of a sudden you just can't even tolerate it. You don't want to go outside, you don't want to do anything, you just want to be warm, you just want to be home. And you're forgetting things all the time. Where are my keys? It's my test today. I have no idea. When am I supposed to do these things? All of these things are symptoms of hypothyroidism. 5% of all Americans have hypothyroidism. Your thyroid, it affects your mood, your skin, your hair, your weight, your energy levels, your menstrual cycle, your fertility, and even your heart rate, all from this one little gland. However, according to the Whole Torque Medical Group, thyroid issues go undetected for years. So you can be suffering for all this time and have no idea. Today we're going to talk about the symptoms and the causes of hypothyroidism. And then we're going to talk about the things that you can do if you think you have hypothyroidism. I'm one of the 5% of Americans with hypothyroidism, and knowing that one pill a day can end all of my symptoms has been a lifesaver. Since there's about 10 of us here, statistically speaking, I think I cover you, but still we're going to talk about what's going on, and I'll cover all of these issues today. So let's look further into this. I'm going to start talking about the symptoms. But first I'm going to let you know what your thyroid is. Your thyroid is a tiny little gland right here in your neck, and it's the shape of a butterfly. Literally the shape of a butterfly, very tiny. Hypo means that you don't have enough of the hormone. So your thyroid is actually underacting, and it affects your metabolism primarily. I'm going to talk to you about my experiences with my symptoms. And then I'm going to give you a list of some of the most common symptoms that you can find in pretty much any brochure in an endocrinologist's office. My first one was exhaustion. And when I say exhaustion like I've never felt before in my life. I've taken red-eye flights, I've had children, I've been up all night long, I've partied until 4 or 5 in the morning. I know a lot of after-hours bars, but I was exhausted. I would not be able to make it through my day at work. I would come home and desperately want to take a nap. And then I'd be ending up in bed at 8 o'clock at night. Now I know I'm old, but still 8 o'clock is a little bit early for me to be going to bed. Not only would I be going to bed at 8, but then when my alarm went off at 5:30, I physically couldn't get out of bed. Like I just physically could not do it. That was one thing. Then there was the irritability. We all know, either we are a woman or we know women in our life. Women can be irritable. Sometimes we don't even make sense. We don't even know why we're yelling. Sometimes we don't know why we're yelling. But I was really irritable and over crazy things. Like my husband would make spaghetti for dinner, but I was in the mood for linguine. So I would literally freak out, throw the spaghetti at him, and leave the room. Like crazy irritable. And it could have been anything. And it didn't have to be my husband. It could have been my kids, an innocent person walking across the street, somebody who just called when I didn't feel like talking to them. Now, after I'd have these, we'll call them episodes, I would realize I was being crazy. Like, do I really care about spaghetti or linguine? Guess what? No, I don't. So that was a big clue that something wasn't right. Then there was the I couldn't lose weight. I'm a woman, I'm almost 40, I just had a baby. Yeah, I couldn't lose weight. Maybe that could have been the reason, but I really couldn't lose weight. I mean, I was doing all the things I did last time I had a baby, and last time I had a baby, I lost all the weight. So what was wrong? And I wasn't exercising, I'll give you that, but I was eating right and doing the whole nursing thing, which really takes the weight off, but it wasn't working. But the big one for me, and this is why I finally did go to the doctor, was the forgetfulness. I'm a very organized person. I work a 50-hour week, I commute 4 hours a day, I still take classes, I raise my children, I'm very organized. I have all of my Christmas gifts done in June, I have birthday gifts done months beforehand, I have plans, I have schedules. I was forgetting everything. It was Christmas time and I realized normally I have little gifts for the kids that match and they're cute, and I just wasn't doing it. I was forgetting everything, leaving everything to the last minute, and it just wasn't like me. So I decided that it was time for me to get checked out. So those were my main symptoms. But according to the endocrineweb.com, and you can also find this on just about any brochure, the common symptoms are fatigue, weakness, weight gain, or the inability to lose weight, coarse, dry skin, dry, rough, pale skin, coarse, dry hair, hair loss, cold intolerance, muscle cramps, constipation, depression, irritability, memory loss, abnormal menstrual cycle, decreased libido. Everyone here, I think, has had multiples of these symptoms at some point in your life. These are everyday, common symptoms, which is probably one of the reasons why it goes undetected for so long. Now that you know some of the symptoms, what causes it? Hypothyroidism is caused by many things, but there are two primary things. They are Hashimoto's disease, mouthful, and damage to the thyroid. The Mayo Clinic says that Hashimoto's disease is the most common reason for hypothyroidism. And I know this is not the best source, but I really don't have a lot of time to look things up. So according to Wikipedia, Hashimoto's disease is the first autoimmune disease that was discovered. It was discovered by Hakura Hashimoto in Germany in 1912. I have Hashimoto's disease, but I was diagnosed with hypothyroidism before I was diagnosed with Hashimoto's disease, even though the disease caused the syndrome. Odd? No? Had this disease all my life and I didn't know about it, and it caused my thyroid to literally eat itself. Why didn't I know about this? Well, this is commonplace. Again, not the most reliable source, but many of my Facebook friends who in my age category have thyroid issues, they have Hashimoto's disease that was not diagnosed until they were diagnosed hypothyroidism. Hashimoto's disease is an autoimmune disease, and it causes your thyroid to switch from being hyperactive to hypoactive over the course of years. This constant back and forth causes major damage to your thyroid until you eventually become hypothyroid for the rest of your life. Eventually, your thyroid does not work at all anymore. It does not produce any hormone. This started with me about 7 years ago. I was at a Flyers game, walking on the concourse, and I started getting lightheaded and dizzy, and my vision went all off, and I went to the doctor, the eye doctor first, found nothing. Then I went to my regular doctor, and they found that my thyroid was extremely hyper, which is the opposite of what I have now. That causes you to get skinny. That's the good one. They said it'll go away soon, just, run it out. So I did. And then again, a couple years later, I wasn't feeling well again, and they tested me, and I was borderline hypo, again, the underactive. And then about 3 years ago, when trying to have my last child, I was having problems keeping my pregnancies. That very well could have been caused from my thyroid, because thyroids do cause infertility. So again, that could have been another sign of the hyper-hypo. And my OB was checking for this, and they found me 1 week I was hyper. 2 weeks later, they checked me, and I was extremely hypo. This is what Hashimoto's does. So that wears and tears on you, and eventually your thyroid becomes completely unable to create the hormone. The other one is damage or inflammation. How does your thyroid get damaged? One is due to radiation from cancer. So it can be from normal cancer. It can also be because you've had thyroid cancer, which, by the way, is most common in females in their early to mid-20s. My sister had thyroid cancer, and to cure the cancer, they remove your thyroid, and then they give you an injection of radioactive iodine. Your thyroid sucks in iodine, so it allows it to suck in the radioactive iodine, and then your thyroid gets completely destroyed. Completely destroying your thyroid makes you hypothyroid for life because you no longer have the thyroid. So that is one way that damage to your thyroid, even though it's purposeful, can cause you to have hypothyroidism for the rest of your life. Another way is from medications. And lithium, a common medication for psychiatric disorders, also causes severe damage to your thyroid that does not ever reverse, and you will be hypothyroidism for life also. There are other causes, such as congenital disease, but they're much less frequent. Most likely you're just going to see the Hashimoto's or the damage. Now we know about the symptoms and the causes, so how do we treat this disorder? The most common treatment is hormone replacement. One little pill, it's called Synthroid, or by other names if it's generic. You take it once a day for the rest of your life. Visually, they'll put you on a prescription. You work by trial and error. They put you on a prescription of Synthroid. They say, here, try this for 6 to 8 weeks. Come on back. We're going to test you again. They take your blood. They check what your levels are. They either increase or decrease your prescription. It can take them 6 to 8 months to get you onto your right levels. It's a lot of fun in the meantime. According to WebMD, the medication will start taking effect in about 1 week after taking it, and most symptoms clear within a month. However, you always have to be watching what you're doing. Any weight changes, pregnancy, or anytime symptoms are recurring, you need to go back and see your doctor. Because it's a hormone, your body needs to constantly check to see if it's in balance or not. Because once it's off, you will become that irritable monster again. So you need to keep seeing your doctor for blood tests. Also, for Hashimoto's disease, there has been rumor to some relief with diet. This is because it is an autoimmune disease, and I'm sure you know of another autoimmune disease that's pretty common, which is celiac disease. You know, with that disease, if you stop eating wheat, you will feel better. Your symptoms will go away. Because Hashimoto's is an autoimmune disease, people have tried this diet called the paleo diet. It's also called the caveman diet. You're supposed to eat like a caveman. If it wasn't around then don't eat it now. I have not tried this diet. I will never try this diet. However, there are a few bloggers that I follow quite frequently, and they have done this diet, and they swear by its effects, especially for exhaustion. They say by changing their diet and taking the hormone replacement has been their best way to relieve all of their problems. There is no cure for hypothyroidism. There is no cure for Hashimoto's disease. You just need to take your medications, be watchful, the symptoms should go away. If they come back, you reassess. So the hypothyroidism can be controlled, just never cured. Hypothyroidism has many symptoms, and most can be associated with the stresses in everyday life. However, when you start having these symptoms and they're not going away and they're in combination, you need to see your doctor so that you can have these symptoms checked. Don't ignore the signs, because the signs are telling your body and telling you that you need to do something about it. No one in this class said that they would see a doctor if they had these symptoms. Some said maybe, most said no, no one said yes. This is why it goes undetected for so many years. A quick doctor's visit, quick blood test can change your life. One simple pill, you go back to being normal, as close to normal as you can be. It worked for me, it'll work for anybody else. Thank you.